notifications, like when they
You'll see comments
and stuff? Okay. All right, let's just look, I guess, a little bit to see anybody joining on. I guess it's a little early, so it's okay.
Yeah.
Okay, well, I'm gonna get right into it. Hello. Hope y'all are all doing great so far. If you are new to Dr. Samwa's Natural Gut Relief, welcome. We always welcome new members, whether you're patients, family, friends, anyone that is experiencing any type of gut issues. This is the place to be. And my name is Rose. I am one of Dr. Samwa's clinical coordinators and a medical assistant. I do work in the clinic. If you normally join on Thursday evenings at 6, hello again. Welcome back. And you're also noticing I am not Dr. Samwa. Well, you are correct. I am not. I am definitely not Dr. Samwa. So, but don't worry. You are in the right spot. Don't go anywhere. You won't want to miss this. So last week, we had a discussion on H. pylori with our lovely physician assistant, Donna. If you missed that, you can go back and you can rewatch it. And come on, you can do it. And this evening is an episode of Back to Basics, where we will be talking about physical therapy for gut relief. Now, who would know better than the actual therapist herself? We do have a special guest, and her it's with Hope Rehab Katy, and we are speaking with Miss Annette. Hello, Annette. How are you?
Good. Thank you for having us. I'm representing one of many.
Yes. So first off, I want to talk about, we've referred a lot of our patients to you. And we had something that was sent to us that a patient did state that referring them to you has improved. That their diarrhea urgency has gone down incredibly. They have a better peace of mind, and first thing in the morning, they're not having to go to the bathroom and make a mess on themselves, and embarrassing, it's very embarrassing as an adult. So we had a patient, had a testimony, saying this about y'all. So it's great to hear. I love it. And so Miss Annette, tell me more. Tell me more, tell me more about yourself.
So I work with Hope Rehab Physical Therapy. We have 2 clinics in Katy. We are an orthopedic-based clinic, but we also treat the pelvic floor. And so that's where the pelvic health component has come in, and where a lot of our patients have been shared back and forth. And there's details that we're going to go into with pelvic rehab, what that looks like, and maybe the overall questions sometimes patients are hesitant to come in for, and we're happy to kind of clear out the air a little bit for that. But it's male and female, all ages. Pelvic floor is a general muscle, or general area. It includes your pelvis, your abdominal regions, the inside of your hip muscles. So we have a lot that we can talk about and that we can address for sure.
Yeah, that is crazy because, I've not heard of that, to be completely honest, since I've been in the office working with Dr. Samwa about pelvic floor. And I was like, I don't know what this is, but okay, but I don't like to not know what I'm referring my patients to. So I like to do some research, and I think it's amazing. The outcome, the benefits of it, and everything. And Annette, y'all are awesome. I mean, thank you so much for everything that you do. But I do have to ask you this. What had gotten you drawn to choose physical therapy as a career?
So physical therapy is general, right? I love treating the entire body from the outside to the inside. I do as much as I can, knowing that there's specialties within it, like pelvic floor. So I also will treat the orthopedic world as well as the pelvic floor. But in general, getting me into physical therapy, personally, I think there's always somewhat of a personal story that can come with it. And for me, it went all the way back to when I was a child and I hurt myself and I had growing pains and doctors didn't know what to do for me. And I got sent to physical therapy, and that was my first interest in seeing how exercise-based, changing mechanics of the body, changing the balance between flexibility and strength was able to improve my pain that I was having at that time that my parents at a young age had no idea what to do with. Then later on, decided to go into the career as a physical therapist. You come out a general physical therapist from school. You have clinicals that you take and you can kind of try to specialize, but you really don't have that specialty until you start to practice and get the experience or continue with your education. And I was lucky enough to graduate and fall into the hands of another pelvic floor physical therapist who mentored me and showed me the right direction of where to do continuing education. And I loved the population. And I felt that that was just such a need that I continued with that as the years passed.
Yes, it is amazing. I just can't stop talking about it. Like it's really amazing. I can't, because again, with physical therapy, I just thought, okay, you hurt yourself in sports or, something of that sort. And that's all what I do because that's all what I've been across. And again, ever since I've been working in this office, I've got exposed to so much different other things, So I just think that it's just so interesting what all you offer.
It's like you said, there's just that need that isn't always out in the front of the pelvic floor world. As much as I maybe wanted to step away or wasn't sure if I should step away from the pelvic floor rehab world at a time in my career, I almost couldn't because there's always this population out there that I didn't know if they were getting the help they needed or if they even knew that there was help out there that they could get. So it just drew me right back in saying, hey, there's something we can do about that. Let me help you. Let me send you to the right doctor so that they can help you and get you on the right place and the right track. And then maybe physical therapy is also an opportunity for you. So it's just that specific population that always needs some help.
Because it's hard. You don't really hear pelvic floor. You really don't. Again, I've been in the medical field for about 17 years and not have I heard of that. So it's really good that, again, that it's out there. And so, yeah, don't go in it. stay where you're at. We gotta
No, I'm hooked now. Love it.
Good. So I know you gave us a little bit of kind of like a gist of what y'all offer. So are you able to go in detail what Hope Rehab Katy really, what services and treatments we're able to do?
I have to say that the clinic as a whole, and this is why I chose a clinic like this to work for and not necessarily just a pelvic floor clinic. We have to be able to treat the entire body from head to toe. So there's a group of physical therapists, some that do pelvic floor, some that don't, but all our pelvic floor therapists also treat the orthopedic world. So you have to know, as Hope Rehab Physical Therapy, we are able to treat from kids, neural to senior citizens to orthopedic, like sports related injuries. We have an aquatic system, which is phenomenal for even the pregnancies, when we're wanting to unload our bodies and we have back pain for our pregnant family or pregnant population. And we're happy. We treat vertigo. So the pelvic floor part of it, we like to say, hey, you have a private room that you get to be a part of. And just to make it more specific. So I guess if that's more of what you're asking for, when we treat the pelvic floor as physical therapists at Hope Rehab, we're addressing the mechanics of the lumbar region, the thoracic region, because that's where those nerves come from to innervate and tell our bladder what to do or tell our intestines what to do. And if the diaphragm's not working, how is everything below that working? So we want to make sure that our clinicians are all up to speed with being able to look at the body as a whole, orthopedic to neurologically, from kids to elderly, Parkinson's, all that. We want to be able to address that and see abdominal weakness postpartum, or even just as you get older, elderly aren't working their abdominals the right way or their core muscles the right way, and they have separations or hernias that they're coming from. And we want to be able to address that and recognize it and maybe provide some, light on them so they're not having to be a surgery candidate in the future.
Gosh, yes, because even surgery alone, hesitation, especially with COVID, you don't want to go into surgery, anesthesia is just, or the cost even. So finding other options are definitely a huge plus. And it's definitely great to have that, option for that. So tell me, I guss you kind of did already, like a gastro issue, like a specific one.
There's so many, though. I would love to talk about more.
Yes,
So Well, okay, so a specific one, I know we had kind of talked about when I got to come in and meet you guys, there's some of the unique ones, or things that people don't think about. Like I even mentioned the pregnant ladies, like we're all of a sudden peeing on ourselves, or if you're pregnant and you're not able to control your bladder, or you have pelvic pain when you're pregnant, there's things you can do for that. You don't have to live with it. There's opportunities to ask questions for. But let's talk about the gastro issues that you were saying was just like specific or unique ones, right? Abdominal pain is just so general, so that when you go to the physicians, the clinicians can look at all the signs and symptoms and do the different diagnostic testing and send out for, let's even just say, endometriosis. Some people feel like they have to live with that, or like abdominal pain from constipation, chronic constipation, even more so, surgery, right? They had their gallbladder removed, or had an appendicitis, an appendix removed, and now there's scar tissue, and things just aren't flowing the way they should be. Even let's talk about like frequent urination. Who's to say that is something you should have to live with? Like, it gets worse, and it's just going to keep getting worse if you don't get on top of it.
Yeah, as an adult, it's embarrassing. You shy, you don't want to go to your doctor and like, hey, myself, or making it's really, really hard to really go to as an adult to a provider. But I mean, you can. It's not like you can't live like you said. You don't have to live like that.
You don't have to live like that, right?
Yeah. So that, I guess that really, like, I mean, is there something that you feel that we should like that we don't think of, that we can always say like, we'll just put it off, like for us to really think, what, maybe I should go see Dr. Samwa or a provider to say, I want to go to Hope Rehab Katy and go see Annette and her fabulous team.
My first one's going to come with the urination. I feel like that sometimes is just so easily ignored. And my biggest question, and that I spend time with in that first evaluation, is I ask patients if they have what's called nocturia, or how many times are they waking up at night to go to the bathroom. And everybody just settles and says, I get up 3 to 4 times a night. I'm like, no. Do you know how important rest and sleep is? Let's not even talk about the fact that you need to sleep, and sleep for a good amount of time, and stay in that, I don't really open my eyes or anything like that, but you are. And so, man, all I can say is, from my experience, from what I've read, is one time a night turns into 3 times a night. 3 times a night turns into 5 and 8. And that just, don't live with that.
No, yeah, please don't. No. Okay. So, explain to me, like, I am not aware of any medical terms or anything, as if I'm just brand spanking new and I'm just like, oh my gosh, I am, getting up all night long, going to the bathroom. Can you tell me what do I do?
So let's make sure that your physician cleared out any of the concerns with the bladder or the GI, right? So now, like, for example, Dr. Samuel will send you to physical therapy for frequent urination with the appropriate medical care. The physical therapy part of it will look at, I already talked about, the spine and the pelvis, but we'll look at the abdominal cavity, which is like a balloon filled of organs and soft tissue and viscera, which we call like the netting, the myofascia, the fascia between your organs. So we look at how that rests in the bony structure of your pelvis. And then the pelvis is attached by a ton of muscles from the spine to the hips. And then the bottom of the pelvic is that beautiful diaphragm of the pelvic floor made up of many little muscles. And to be completely clear, and this is the clarification that a lot of patients want to know, is how do we address those? How do we get to that? And that's the specialty behind a closed, locked door that you approve as a patient, saying you're okay with it, to let us feel and treat the muscles specifically. Internally, we are working. For females, vaginally, usually. We can also go rectally when it's appropriate and necessary. For males, that's rectally, assessing the pelvic floor muscles and specifying where are the restrictions of weakness to strength. that's in a nutshell, like what we are trying to work with and try to help out become balanced, become functional, which causes efficient movement or activities of daily living. Does that help? I don't know. Was that enough? I try to keep it simple.
That was good.
Call.
Okay, so
there's more questions on that. I know there's a few comments.
Yes, and I see. Okay, so how long will it take for patients to see results?
Okay, it's a tough question. I personally, it depends on who you're seeing, the relationship you have, your history you're coming with. Mm-hmm. I would like to see results within 1 to 2 weeks of a proper plan. Okay. So that means you've been assessed, and you also have your team approach of your medical provider. If you need any counseling, that there's a proper approach and a proper team working with you as the physical therapy component becomes a part of it, and you're being treated appropriately with the right amount of time. You're able to do your part at home, no other variables. Within 1 to 2 weeks, you should feel different. Does that mean there's the results you want or not? Hopefully, but everybody's different. And so I basically like to say that within 2 weeks, I need to know that what we're doing is on the right path, or we need to veer off and find another path, because it's all about putting the pieces of the puzzle together for every person. They're all individuals. They're all different. And we just have to figure out what those puzzle pieces are. Does that help?
It does. And of course they have to do your homework. They have to do their exercises. They have to do it. And as long as if you're not doing it, then of course you're not going to see the improvement if you're not doing it. But you can't just do it when you're there at the facility and then go home and like, oh, okay, I'll be fine. I feel fine right now. It's like, no,
the question I would expect people to ask after that is like, well, then do I just have to do Kegels? And the answer is no. It's not. Kegels aren't always just the answer. And what is a Kegel? And are you doing it correctly? Right. So yes, you need to do your homework, but if you're at that point where it's really a problem, it needs to be homework addressed by a specialist, a clinician, a physical therapist has to make you a specific program. At our clinic, we don't have a protocol for everybody to follow. We individualize each person's program. Sure, we have our favorites and we have what we think works best for this issue and that, where you can kind of see like repeat issues or repeat protocol. But we don't have a paper that we give you and say, here, go do this. This is what you need to do. It's individualized.
Like orthopedic, you can't do that. They're different, right? That makes sense.
Yeah.
And then let's see, what would 1 to 2 good exercises to do that people may take for granted?
Ooh, that's a good question. I love exercises.
That's a good one.
It is a good one. And I almost want to say, hey, can you respond and give me like a topic of that, if it's for weakness or strength? Because flexibility exercises are just as important as strength exercises. And again, we're not biased. We're going to do whatever's necessary for that patient. And so I have to say, sitting all day, I think is what I saw.
Okay, there you go.
Again, so my first thing if you're sitting all day, my sweet husband sits at the computer, is flexibility program. So you're going to be opening up your hips. You're going to take the pressure off your pelvic floor, off your hip muscles, off your abdominals, working at opening up. It really does depend. That's the global answer for physicians or in the medical world. It depends on your back, it depends on your hips, right? So if you're coming to me with a surgery or hip problems, I'm not going to give you a specific open or back exercise. But in general, you're taking yourself out of the bent hip position and wanting to open up, laying down, opening up your hips, stretching out your hamstrings, your hip flexors. The best thing I can do for you as to answer that question is to say, open up the front cavity so that you're not so compressed all the time. So.
And it helps to also get up too. If you're sitting all day, you just getting up, stretching that, I would think that would help. You tell me you're.
Yes, of course. Anything over 20 minutes, you're done. You're sitting, you're compressed. So I get it. The business world, I see it. You can get stuck on meetings and you're sitting all the time and for long periods of time. So any opportunity after 30 minutes to an hour, set a reminder, put something on there to get yourself up and move, get some water, do something that can reverse or undo that position, please. Yeah.
Gotcha. Okay. I'm loving these questions, y'all. Please keep them coming. Annette is just on a roll here. Okay. So the next question we have is, can you explain what biofeedback therapy is and who would benefit?
Right. We use biofeedback in both of our clinics. Yeah. So our biofeedback, and it can be used anywhere really on a lot of different muscles. So we do use it specifically for the pelvic floor, our pelvic floor clients for various reasons. Up training is to cause like strengthening. And we also call it down training, where it means your pelvic floor or your muscles just need to learn to breathe and relax and stay at a state of relaxation versus this heightened tone. And just to kind of touch a little bit on what that biofeedback means, like if you're on this heightened tone, is a tight muscle isn't always a strong muscle. So if I have a really tight upper trap and yet I want to go lift something, I can't. I don't have that ability to lift more. Whereas if I have a strong upper trap that can relax, I can lift and raise my shoulders, or same thing with biceps. And that same concept applies to your pelvic floor. So in general, that biofeedback gives the patient as well as the clinician ability to confirm what we've already assessed and what we've been practicing. So it can give you a visual, depending on your different tools. Ours is a visual graph to show if you're up or if you're down. And we try to isolate with where we place our pads, or we use probes to be very specific in the muscles that we're trying to attract. And again, we can do it on our traps, we can do it on our elbows or shoulders, anywhere that really needs to be. But for pelvic floor GI issues, we'll use it in the pelvic floor issues or in the pelvic region, including even your hip flexors if needed.
Nice. Okay.
Anyway, who would benefit? I'm sorry, that was the other part of that question, right? Yeah. So I was saying anybody who's like is either really tight, or if you're not sure if you're doing your pelvic floor contractions correctly, and even if a lot of times we can't feel those muscles contracting and holding. So the graph or the biofeedback gives us that view of, am I maintaining my contraction, or after I hit my peak, am I dropping and not really sustaining that maximum contraction that we think we are, and that we would need if we were walking across the room or running for a period of time. We would want to be able to hold for more than a split second, right? Even if we sneeze, sometimes we don't have time to recontract really quickly. We need to be able to hold a pelvic floor contraction for multiple sneezes, which could be 5 to 10 seconds, if not more. So people that would benefit from that on a strength component would be the ability to hold and withstand, as well as relax, down train. If there's pelvic pain with any type of penetration, we want to be able to make sure we have pelvic relaxation. If there's pelvic tone or tension for our males with pelvic prostate irritation or prostatitis, they can have a pelvic pain that needs to learn to relax. And even when you sit on it or when we lay down, just learning where to be at full rest, it gives you that feedback.
Okay. And for for the males, do they have to be referred by a GI doctor for to be referred to y'all, or is it any provider, any specialty can just write up the list and order and send it on over to y'all?
Physical therapy can be referred to by any clinician, or even chiropractors that work very closely with patients. For in the state of Texas, that is considered a clinical referral. And so some primary care physicians will also send over. And then when they come into our office, we will do that full assessment and history check and see if there is that need for the specialty referral, where we're like, have you had that checked? Maybe you should go see a GI or a gynecologist or urogynecologist, just so that we're continuously working as a team. I mean, that's always our approach as a therapist.
Okay. I was curious about that one. Okay. Mm-hmm. So Sarah is asking, would you recommend yoga and core restorative types of yoga to help strengthening the pelvic muscles, or to be
hurtful? I love yoga. I'm a yoga fan. I love yoga. I'm a yoga fan. I think it's a personal choice too. You really have to be able to do it appropriately and achieve the movements comfortably, be comfortable with what you're doing in order to see the benefits. Some patients just don't do well with it. They're too much in their mind and they're not able to relax, where some patients have too many other joint issues or shoulder problems that can't relax fully. So You'll find that I have a lot of yoga in my home programs, just that I'll use yoga poses or things from that. But overall, I think a continued yoga practice is great because it works from the inside out. Now, there's a time and place where we overstretch. And so again, individual programs might be veered to certain directions of yoga or certain type of yoga. And like any place or any type of workout, there's always some good yoga instructors, and then there's some that veer off that and maybe don't have the same practice that would do well for somebody, but you kind of have to individualize that and find it.
Okay. And then does Hope Rehab offer abdominal or visceral massage? I could be saying that wrong.
Yes, ma'am. Yeah, we love to work with the abdominal region. For those of you who don't like the umbilical region, the umbilicus is a beautiful hook for our fingers. And so we don't have to, but a lot of times we'll find our fingers kind of staying at that center and figuring out what clock of our abdominal regions. We split everything up into quadrants. Yes, visceral, it means organ. So our organ massage isn't really the term I would use, but massage in hands-on work, just to fine-tuning the mobility of organs on each other and within the cavity of your abdominal region is really important to have an efficient flow of everything. So we do that as well. Mm-hmm.
Oh, nice. Okay, so you're welcome, Sarah. And I'm not seeing any other questions. Is there anything? Okay, wait, I have a scenario. Okay, so let's say I saw Dr. Samwa and she referred me to you. What are the next steps?
Okay, so either sometimes this is where the front desk part of it.
I know what I need to do.
Yeah, I think you send the script. No. So I don't know. I have to give credit to our front desks at both clinics. I mean, they're so good about, reaching back out or trying to get all of our patients on the schedule. So we couldn't do our job as clinicians without them. So they are that in-between person on getting the patient's insurance. They're, creating them as a patient in our portal. And once that referral is made, patients can call the clinic or we call them depending on where that, the communication was made to try to get in for what's called an initial evaluation. And that's that first day where we really want to get to know our patients and get the entire history, get the entire story. So it's really important not to rush that visit. And so we do take that long hour to be with our patients in that time and try to go over all the paperwork and come up with a plan. We want to make sure that our patients are comfortable and understanding the pelvic floor internal portion of it. That's so important. And often we do that first internal work or assessment is really the best way to put it, because I don't know if I'm strengthening or if I'm stretching that first day to figure out what do we want to try, which path do we want to go down to do some therapy. And so we'll do a full evaluation from low back through hips, from outside to inside, ideally, within that first visit. And then we schedule more visits following, depending on what's necessary and what we've decided the patient needs.
And is this going through like insurance or is it self-pay or?
Hope Rehab takes all forms of insurance. Again, this is more front desk question, but I think Medicaid, we do take Medicare, and we try to be as work with as many insurances as possible.
That's awesome. Okay.
Yes. And then we also have a cash pay. We do have a cash pay rate too, which is personal, always available for patients for sure.
Right. Okay. Well, I believe that sums it all up. Annette, you are amazing. Thank you so very much
for having us and me.
It was a pleasure getting all the details, and I'm getting goosebumps even thinking about how much you've helped our patient. I mean, it's just that's the goal. Patient care. We got to take care of everybody. Got to save everybody. But
we are happy to help. We appreciate all the referrals, and we look forward to working together moving forward.
Yes, and we got more coming for you. So, but thank you again, Annette. It was great getting all the details from you, the facility, and it was a pleasure talking with you. And everybody, y'all tune in next Thursday at 6:30 for the next episode of Back to Basics Natural Gut Relief. Thank y'all again, and thank you again, Annette. It was great talking to you. Talk to you soon. Bye.